Hi, ladies and gentlemen. I am going to talk today about a topic that's relevant to couples. It's relevant to childbirth, and it's really serious. I want to talk about operative deliveries. So if you're someone who's pregnant, or one of my pregnant patients, or someone who's thinking about being pregnant, or if you just had a baby and you think it's interesting, this is a conversation that I like to include fathers of the babies and my patients about operative deliveries at the time of a baby's birth, because it's really serious. So a lot of people don't know what I'm talking about when I say operative delivery. We know that we're in labor, that we are pregnant, and we're going to go into labor, and a baby is going to come out of hopefully our vagina. And we also know about C-sections. So that's like, everybody knows how babies are born. And then if you can't get the baby out, you do a C-section, and that all makes sense. There is an in-between category that obstetricians, which means doctors that deliver babies, talk about a lot, and those are called operative deliveries. That's this global term. But frankly, an operative delivery means a vaginal birth that's assisted with an instrument. And when a doctor suggests this, it can be really serious or not. So I want to talk this through with you. I talk to all of my patients about this in the third trimester because I don't know who it's going to happen to. So I just make a point to talk to every single couple about this because it's really serious. And what it is it's about consent. It's making sure that they understand when they come to the hospital in labor, they're going to sign all these consents that allow the hospital staff to permission to do all these things like C-sections and things, but a lot of them haven't heard of operative deliveries. So what are they? So there could be a circumstance in which a woman is pushing. And we'll remember that like a first-time mom sometimes pushes for 3 or even 4 hours sometimes. So sometimes pushing can take many hours after a couple days of labor. So by the time a woman gets to the point of pushing, she's exhausted because she's been in labor for a couple days. And then pushing itself, especially for a first-time mom, can be several hours. But fortunately, because the baby's being born, but unfortunately, that's when a lot of exciting things can happen during the act of pushing. And so what happens is the baby is getting squeezed into the birth canal. So when I think about a woman and her baby in this setting, I'm thinking about her body as like a skeleton. And I'm thinking about how the baby's head has to enter her pelvic bone, her skeleton. So sometimes while that's happening, as the baby's coming through and the baby is getting squeezed, sometimes the umbilical cord gets compressed. So you've heard of this before because you've heard of like so-and-so had the cord wrapped around their neck, or cord around the neck, cord around the neck. We talk about that all the time. Just so you know, that happens in 1/3 of pregnancies, 1/3 of deliveries, the cords around the neck. So it's usually actually not that unusual or that big of a deal. Most of the time, if it happens, we can kind of figure out the baby's a little stressed, but usually they can handle the labor and delivery fine. Sometimes though, they're not handling it fine. Maybe the cord isn't around the neck. Maybe it's around the shoulder or around like the chest or around the neck a couple times or like under the armpit. So as this kid comes through this tight pelvic structure of the birth canal, the squeeze is coming. And so maybe that cord that was fine, but now it's under the armpit is being squeezed every time the woman pushes. So obstetricians, we see this all the time. To some degree, we expect it. A woman is pushing, and during the pushes, we can see that the baby's heartbeat goes down as that umbilical cord can get compressed. And we'll be aware of it, and we'll note it, and we kind of expect it to some degree, but sometimes it goes down really far. The heartbeat will be at 140s, and they'll go down to like 60s or 50s, and then it generally will come back up between pushing. Sometimes it doesn't come back up, or sometimes it goes down. It's just really, really severe. So we start to worry over time that maybe the baby is going to start becoming hypoxic. And that means you're concerned the baby might not getting enough oxygen to the baby's brain. So because of that, a doctor might say, hey, to the patient, I think we should do an operative delivery, which means I want to get the baby out right now. A baby has a 7-minute oxygen reserve. So if a baby is like perfectly well oxygenated and then all of a sudden someone clenched the umbilical cord, no more blood flow to the baby, you got about 7 minutes before the baby starts to get unoxygenated or deoxygenated blood, and you start to worry about something called acidosis, where the baby could have long-term sequelae from not getting enough oxygen. So operative deliveries are defined as instruments used to help the baby be born vaginally. So sometimes if you think the baby's stressed, you think the answer is to go straight to a C-section, but actually that's not always the answer. If the baby's body is so low in the pelvis, sometimes it's safer to get the baby out vaginally, but we just have to move quickly. So I might say to the patient, I'm sorry, we don't have an hour or two to push. The baby is stressed. I think we should use an instrument. Those instruments are two. There's either a vacuum, which is a scary word, vacuum. It's not a vacuum, it's a suction cup. I wish I had one, but I don't have one. They're kind of expensive, but you could Google vacuum delivery, like vacuum vaginal birth. Go on YouTube. But basically, guys, it's just, ladies, gentlemen, it's a suction cup. It's a suction cup. It goes on the baby's skull like this. Kind of the baby's skull is protruding out a little bit through the vagina, and then I'll put it on the baby's skull, and I'll say to mom, okay, you push, I pull at the same time, and I'm gonna help you get the baby out because we have to move quickly. Sometimes we decide instead of a vacuum, we'll use something called forceps. Forceps are like two long spoons that go on either side of the baby like this. And so a doctor might place them inside along the baby's skull and help pull as the mom pushes. My eldest daughter was born with a vacuum by a doctor that I had never met before, and I'm so grateful to her. My daughter's name is Julie, and she was very stressed. And I was young, and I didn't know what was going on, but she came in to the delivery room, and she said, Jill, I have to deliver your baby right now. I'm going to use a vacuum. And I appreciated that she was bold and confident and knew my baby was stressed and got my baby out and did not necessarily take me down the hall to do a C-section so then I could subsequently have vaginal births instead of more C-sections. So operative deliveries can be a really scary thought because we're stressed that the baby is stressed, but it's a great way to avoid a C-section. And sometimes it's the safest thing. The reason I bring it up is because when we have these moments where the heart rate drops and it's down for a couple minutes, I don't have 10 minutes then to explain to the patients what I want to do. And it's kind of scary. So there are risks to operative deliveries. We're putting instruments on the baby's skull. So the risks could equal, skin lacerations, bruising, skull, never had it, but like skull fractures, potentially like bleeding in the brain. Like it could lead to potentially like fetal death, like all of these scary things. But the reason we talk about it and make sure the patients understand about this is because when we're doing it in these circumstances is because we're afraid of what's going to happen to the baby if we don't do it. So the reason they have this conversation with your doctor before you're in labor is because you want to understand what the doctor might do if the baby tanks and needs to be born right away. And you should be well informed about what your options are. So if you're somebody that doesn't like those risks, doesn't like the idea that there's something on your baby's skull, it's something that warrants talking to your doctor about beforehand. So the three of us, the couple and I, can all decide before we're in that situation, how are we going to get your baby out quickly if we're in that situation. So periodically a patient say, I don't want to use instruments, Dr. Scherbel. I don't want to put instruments on my baby's head. So then I say, okay, so then if we're in that situation, we would do a C-section. So it's a very important conversation that I think every obstetrician should have with literally every single patient. It should be standard counseling because it's so serious and we don't know who it's going to happen to. So we should just talk to everybody about it so that they're not blindsided if this were to happen to them and they feel empowered. One last thing while I'm on this topic is this idea about episiotomies. That's the word for when a doctor cuts a woman, the baby's crowning, you got to get the baby out for whatever reason, and the doctor cuts a woman. Just that is not standard of care. We do not routinely do that. I hardly ever do that. It has its own problems, which maybe I'll talk about another day. I will do it if it's that or the baby's brain tissue. I will cut a woman, but it's extremely rare. So just quick note to let you guys know, if you're my patients, please ask me about operative deliveries. I will talk to all my patients in the third trimester about it anyway. And if you're not my patient, I encourage you to talk to your doctor about operative deliveries and episiotomies and make sure everybody's on the same page. And also I would say if your doctor has not discussed these things with you, You should ask why, and maybe you should come see us here at Scherbel Clinic. So I'm Dr. Scherbel. I work at Scherbel Clinic. I'm excited. This is our new location. We've moved just a couple miles up the road to Creve Coeur. So if you Google us, we're on Stutt Road. And I'm Dr. Scherbel. I work at Scherbel Clinic, and we give superior care, so come see us. Have a good one.